Okay, thank you, Chair. The meeting is now live.
Thank you very much, Lizzie. So welcome everybody, including our member of the public, Alan, you're very welcome. Just to say, I'm Nicola Airy, I'm the place convener for Bracknell Forest for the ICB, and I'm going to chair this meeting today as Vice Chair, as our chair is currently in Kenya, and thought that might be a good idea because connections aren't perfect. So really pleased that you're all here and that we are live streaming. We'll start with just going through the apologies. Lizzie, do you want to just list those so that we can note them?
Yes, no problem. So I've had apologies from Alex Guild, Andrew Hunter, Sonia Johnson, Melanie O'Rourke, and Fidel Martinelli. Has anyone else got any others? Nope, then I think that's it. Oh, I think Grania Sagans has just said that she's having connection issues, so she is present, but having some issues.
Marvellous. So we'll note those apologies. Is there anybody else here substituting for somebody, or is everybody here in their own right? Okay, so no substitutions. That's marvellous. Okay. Just to note, Lizzie, have we got any particular conflicts of interest that have been raised with us?
Nothing that's been raised with me, unless anyone has anything to note.
Any conflicts of interest anybody would like to raise based on the agenda? Okay, we'll note that none of those have been raised. In terms of any urgent items for business, we haven't had any notified to us, so there's none to record under that agenda item. So we'll move on to the minutes of the previous meeting. So does anybody have any comments on the accuracy of the previous minutes? Okay, so we'll agree those as a correct record. Thank you very much. I think there were two matters arising from the minutes. The first one was around domestic violence in the annual report, and that's on the agenda. The second one was when would be the appropriate time to bring the new ICB structure to this meeting for a discussion. I'm happy for that to come to the next meeting. We'll just double check that we've got space on the agenda for that. So those are the two actions from the minutes. So the next agenda item is around public participation and whether we've received any questions. And Lizzie, I'll just hand over to you because I think we have received a question for this meeting.
We have indeed. So just to confirm, we've had a question from Mr. Thompson, who is present in the Zoom meeting, in relation to agenda item 7 on today's agenda. Mr. Thompson, are you happy for your question to be taken as read? I'll just share it on the screen so everyone can see.
Yes.
Can you see that?
Hasn't come through yet, Lizzie.
Oh, it says it's loading. Hold on. Let me try again. Or actually, the agenda was the question was circulated to. Can you still hear me?
Yes.
My screen's frozen. If the question was circulated to board members earlier today, if you're happy to take that as read, Mr. Thompson, I think Hema has an answer.
Yes, I'm happy, and Hema can cover it after her update because it all ties in, I think.
So I think the chair would like to take the question.
Okay.
Lizzie, could you just read the question out for people,
so
and then
I'll hand over to Hema.
And then Hema can give the answer. Thanks, Hema.
I can. There we go. A project to evaluate the Bracknell Forest Health and Wellbeing Physical Activity Service has been carried out over the previous year, and a report with detailed findings and recommendations is due at the end of March. Can follow-up be scheduled to apply these findings to work out practical solutions and involving co-production, and with the aim to get more people using the existing services? The existing health and wellbeing physical activity service has capacity for more use, and getting more people using them links with wider objectives on health, aging well, and keeping active. This evaluation was commissioned by Bracknell Forest and carried out by an external team in PHIRST South Bank, which is one of the 6 public health evaluation centres funded by the National Institute for Health and Care Research.
So
Hema, do you want to give your answer?
Yeah, that's fine. So I'll give more broad answer when will be copied into the agenda 7 presentation. But just one correction I want to make on that is Bracknell Forest Council funded the project. So there's a health and well-being coach for the project. So we fund that. And the Everyone Active, our sports center, looks after all the other program expenses. FRIST is part of the National NIHR Evaluation Center, and what we had put in a bid was for them to evaluate this program as part of their research findings. So I just wanted to make first that correction. We did not fund FRIST. That is funded by NHR. We received the report last Friday only in the evening, so we haven't had time to go through the details of the report. But the report will be reviewed by the Bracknell Forest Physical Activity Network, which is co-partnered by a lot of stakeholders. And they were also one of the stakeholders within the evaluation. So they did feedback to the evaluating team. So once that has been reviewed by the network will look at the recommendations and update its action plan to increase the participation, as well as look at where there are gaps. So that once that has been done, we will bring it to the Health and Wellbeing Board as part of the refresh of all the actions in the Health and Wellbeing Delivery Board, which will be in September. So in September, we'll bring back the follow-up. Alan, is that?
Thanks, Emma. I think, Mr. Thompson, you have the opportunity to ask one supplementary question if you have one arising from that answer.
Yes, there's quite a lot of specific information that's applicable now to the existing services. And I think a more focused approach rather than consulting lots of people. It's really a management issue for the commissioners to get a number of changes to make the service more cost effective and being used more. And the report indicates what they can do rather than go on and consult with all sorts of people. But there are interested people like myself who can actually point out things that are practical to follow up the findings. I hope that helps.
Yeah,
So,
no,
if I just turn that a bit into a question so that Hema can reply. What I heard, Alan, is how can interested individuals be involved and provide their insight and knowledge into this piece of work, Hema? How are we engaging with people who might be able to provide expertise or additional knowledge into the work that's taking place, such as people like Alan? Have we got a mechanism for engaging them in this?
In terms of the implementation of the findings? Okay. So the health and the network, I don't know, Alan, whether you're part of the network, because they do.
Well, that's a wider body.
Yeah.
And there's a much more specific thing to do with just the services that you are commissioning from the Bracknell Leisure Centre for health and well-being and physical exercise. Yeah. So it's more focused, and it's more about user views and real experience of getting the services up and running again after COVID.
Yeah. So the question is more specifically for the services run by Everyone Active and how we can use a focus rather than the broader. So in terms of that, yes, Ellen, as you know, we have previously, Louise Watkin and myself have discussed with you how we can improve some of the services. So you're right. As part of the Everyone Active services, we definitely do involve and will be involving people like yourselves to see how we can make it more. And we did increase some of the participation, as you are aware, because that's something which we obviously are interested, both ourselves as commissioners and this Everyone Active as providers, to increase participation in activities that are being held by Bracknell Forest Sports Centre.
Yes.
But we also
there are opportunities to do this short term, and the report highlights where to focus, the population groups that are most likely to benefit. Lots of detail, and it's all good stuff about the population. I mean, one of the significant findings is that
Alan, I'm gonna stop you there. I think this has been a really useful question, and really thank you. It sounds like there are lines of communication and and ways of taking this forward outside the meeting. But it's really
Yes.
important that you've raised to our attention how important local residents feel about this and having an opportunity to shape it. So thank you very much. Really, really welcome question. And Alan, if you could put your microphone on mute now, that would help as we go forward.
Yes. Thanks very much. Thanks.
Thanks, Alan, and thanks, Hema. Okay, moving on to the next item on the agenda, Hema, I think it's an update from you about the Health and Wellbeing Board's strategy and where we're up to. There are some recommendations in it, so don't let me forget to go through the recommendations at the end of the agenda. So over to you, Hema. You're on mute.
Okay, I'll take it that everybody has read the report in detail, so I'm not going to go through the full report. The key thing this time that we are presenting to the Health and Wellbeing Board in terms of the progress report is the last time, from last time you will remember that there are two areas of interest that the board did ask for. One was about obesity and the other is to talk about vaping. So both of those fit within the priority 5 of the Health and Wellbeing strategy. So we are doing more detailed presentation of both what we are doing in terms of obesity and what we are doing in terms of tobacco, rather than not just about vaping, but also about tobacco control and supporting people with supporting people to change their behaviors. So there are 3 things which I want to talk about before we jump to the more detailed presentation. And I've got Tanvi, who's our lead for obesity, and I've got Louise Duffy, who's our lead for tobacco control with the presentations that they've got. They'll go through briefly outline what's been happening. But the key thing that we have taken an approach in Bracknell Forest is to take a system-wide approach to both tobacco control and obesity, as well as supporting people who have the behaviors that they want to change. So people who are overweight or obese, how do we support and enable them to lose weight through our targeted weight management program, adult weight management program, as well as we've got programs for children, which we are running through schools in supporting the whole school approach to weight management, that is healthy eating, physical activity, etc. In terms of tobacco control, also we have got a wider tobacco control work that we're doing, but we're also working with our smoking cessation service. So we commission Solutions for Health to support people to give up smoking. So people who want to quit smoking, we are enabling them to quit smoking, and it's quite a good service. But one of the recommendations from today is that we want to increase the number of smokers. So we've got some extra funding from DHSC. So we want to use that to increase the number, double the number of smokers who quit. We also want to extend our smoking cessation service for anybody who uses tobacco. So whether that's vapes or whether that's oral tobacco use, we have spoken with our smoking cessation service and looked at clinical guidelines, and they're doing it in other places. So we have said we would want to extend that with the money that we got from DHSC. We also want to start a pilot for young people, because as we all know that there is quite a lot of, and this has been in news, about young people taking up vapes. So we want, and we have heard both from parents and from young people who have been addicted to vapes, they would like to give up vapes. So we want to do a pilot in terms of supporting young people to give up vapes. We have also worked with BHFT, because the other thing with vaping is that people who swapped from smoking to vapes, and if now because of the lung conditions they have to be given oxygen at home, then they need to give up vapes. BHFT or any hospital cannot prescribe that or support them with oxygen at home unless they give up vaping. So we again want to extend that to make sure that people who are vaping can give up vapes if they need to give up vapes for medical conditions. So these are some of the recommendations that are on the to the board. And the last one with vapes that we want to get approval is that ICB are doing a text messaging pilot where they're going to use connected care, and from connected care they're going to start text messaging people who are smokers, because the GP practices have got lists of people who smoke. They want to use text messaging to start asking people, referring them to our smoking cessation service. There is a little bit cost, but we can fund that cost again through the funding we have been given by DHSC. So that's another one which we would like the board to approve. With the obesity, we would like the board to approve. We have been going through the process of an evidence-based process, which there are 6 stages. We have reached up to 4 stages, and that was completed with the previous approval from the board. We would like now to move on to the stage 5 and 6, which is a managed network. There will be some funding costs for that, and the 4 strategic actions that the process has, the whole system has agreed to take forward, but that can be funded, and we'll look at the cost, but the cost can be funded through the public health grant as well. So these are the recommendations we want to make to the board. I will ask Tanvi to talk about obesity and what the process has been through and where we are with that. And then Louis could perhaps, I know it's the later on the agenda, Louis will come on the vaping project.
Thanks so much, Hema. Tanvi, over to you.
Yeah, thanks, Hema. Thanks, Nicola. So yeah, in terms of what we're doing around obesity in Bracknell Forest, like Hema said, we're not just focusing on weight management programs, but also focusing on some of the most strategic level actions that we can take. So we've implemented the whole systems approach to obesity together with the University of Southampton. And it's basically an evidence-based process where we bring together various stakeholders to develop a shared vision on how we're going to tackle obesity going forward. It's been quite a process, quite a long process. And like Hema mentioned, we've completed 4 phases so far. So the first phase was all about stakeholder mapping, so looking at who the key players around obesity are, not just public health, but also the wider council, so teams like planning, uh, parks and countryside, and also the ICB and voluntary sector as well. So bringing together all the players to develop a shared vision. So that was the first phase, and we also set up a joint steering group to take forward the project, basically. The second phase was all about stakeholder engagement. So we did a lot of work around, carrying out surveys, focus groups, speaking to members of the public, speaking to professionals, getting their views on what the issues are for Bracknell Forest, and then what we could do together to make a difference. And the third phase was basically coming back together as a group and then deciding what the key 4 strategic actions would be for Bracknell Forest, which I'll go through in a bit. And then the fourth phase was basically developing action plans to take forward these strategic action, which were basically based on all the consultations that we had with all the members of the public, professionals, and also the joint strategic group. So the first action basically is mapping the food environment. So looking at the different food outlets in Bracknell Forest, how many fast food outlets do we have, but then also looking at it alongside other data. So for example, primary schools, how many fast food joints do we have within a 1-mile radius of primary and secondary schools, etc. The second one is all about enabling healthier food, healthier diets. So working with chefs, local chefs, etc., to create some sort of digital platform where residents and professionals can share their stories, local stories about how they went through their own weight loss journey, share recipes and things like that. The third one is about creating a network of health champions who could support each other on the weight loss journey. And the fourth one is about working with supermarkets and stores to influence the way that foods are displayed. So this is some research that University of Southampton had done, wherein they looked at the display of certain foods in supermarkets and how making small changes in the way that foods are displayed could influence the shoppers' buying habits and behaviors. So these are the 4 actions. And the next phase of the project is basically taking forward all these actions, bringing the joint strategic group back together, and then taking it all forward. So that's the work we're doing on whole systems approach to obesity. We also have a number of weight management programs locally. We have the adult weight management program and the children and young people's weight management program. The adult one is very popular. We get a lot of referrals coming through. It's a 12-week program And it focuses not just on healthy eating, but also physical activity and behavior change. The children and young people's was a bit slow in terms of getting referrals, so we've had to change course a bit. I think one of the issues was that professionals on the front line not having the confidence to be able to bring up the issue about weight with families. So we've been doing some work around that, where we work with the frontline staff to try and build their confidence to be able to give out those messages around weight. We've also started to do work with schools. So we're working with around 10 schools, primary schools. And it's a 6-week program where we work around, healthy lunch boxes, giving children, raising awareness about shopping. We also have workshops with parents and staff. So it's everyone involved, basically. And then, like Hema mentioned, we have our physical activity program. It's both a universal and targeted. So we have a lot of classes in the community, like Tai Chi, Fit for All, Strength and Balance. And we also have the Wellbeing walks, which are really popular. And like Hema mentioned, we're also funding Everyone Active. So we have the mums and baby program, which included things like yoga, baby massage, etc. That's now come to an end. And we also fund the health and well-being service, which is basically for people with long-term conditions who want to improve their physical activity. And we fund the health and well-being coaches as part of that program. So like I said, there's lots happening. And we're bringing it all together basically into our community map, which residents can access, professionals can access, and they can just filter and look for all the physical activity programs in their local area. There's also the Eco Rewards, which is basically incentives for schools and businesses for using active travel. So there's a lot happening in Bracknell, and yeah, that's
so much happening. Before we move on to the discussion about vapes and the Tobacco Alliance, Hema, would this be a good time to open up to questions, or was there anything else you wanted to cover under this agenda item before we go back to the recommendations? Has anybody got any reflections or questions that they've got for Hema or Tanvi?
Hi, Nicola.
Hi, Megan. Welcome.
Sorry, I can't work out how to put my hand up. Oh, here. Sorry. Well, anyway, I jumped in. I just wanted to, and I'm really sorry, I've only just looked at the obesity supplement now. I just wondered if we had targets of how we're going to. Have I missed that? Did you?
No. It's the same question that I would have, Megan. So,
okay, because I'm just really interested in, and it also ties in with what the guest asked us now, Mr. Thompson asked us now, because I think to see that we've got really high obesity rates in that older population is when there's so much available in Bracknell. I just wonder if it would be helpful to have some targets and then look at how we can reach those targets. And then but great to see all that stuff happening with children, because obviously that's where we need to make sure we get in there early and make a difference. So yes.
So do you want to cover the question, Hema or Tanvi, about what are we measuring and how are we measuring whether we're having an impact? Because we're doing a lot of things. It's really impressive. And is it too early to be seeing any improvement, or have we already seen signs? And how regularly are we looking at that data to see if all the effort we're putting in is having an impact?
Now, with the whole systems approach to obesity, we don't have targets as such, but it's something we will build into the action plans going forward. With the weight management program, adult one, we do have targets, and it's basically the number of people who are achieving a 5% body weight loss, number of completers, etc. So far, it's been very challenging to get the correct data from the provider and work on that. So we've been working on that to improve the way that they collect data, they report data. And we are seeing improvements. We are seeing about 30% of people who are enrolled and in the program and starting the program who are actually losing that 5% body weight. But also improvements in things like well-being, because they measure mental well-being as well, increase in physical activity. So people are doing more physical activity after being part of the program. So it's not just focusing on weight loss, but also other things like, behavior change, physical activity, social interaction, mental well-being as well. With the children and young people, it's been challenging as well because the referrals have been slow. So it's been challenging to get any real data from it. But we have a lot of qualitative data from families, parents saying how useful the program has been to them, how they've learned so much and improved their awareness, etc. So in terms of children, we don't have any data in terms of weight loss, but we have a lot of other rich data like qualitative data.
Hema, did you want to add anything into that before I go to the recommendations and perhaps add to them some around measurement? Nick, I've seen your hand. Hema, did you want to come in there or is that sufficient? I think she might have gone off screen. Nick, did you want to ask your question or continue with the conversation?
Yes, just very quickly, and out of interest, lots of initiatives going on, the mapping exercise. But I was just wondering, have we looked at, as part of all this, or do we have a sense of the types, quality, healthiness of the food that's served in the canteens of Bracknell schools?
It's very topical today, Nick.
Yeah, that's part of the actions from the mapping the environment. So one of the actions from there would be looking at different environments and the quality of the food. So we'll be looking at schools as part of that. It's definitely one of the actions. But as of now, I don't have the data. But yeah, that's something we'll be working on.
Great, that's on the cards. Great, thank you very much. Should we just run through the recommendations so that we don't lose them? So just getting them up. Of course, now I can't find them having had them up. Right, so I think there were a few of them. Some of them are to note. So firstly, just for us to note that there's this dual approach within the programme of doing things on a whole sort of system and service basis and then supporting individual people. So I think we can note that. Just is everybody content to agree the next steps that were recommended about establishing a managed network to deliver all 4 strategic actions for the whole system approach to obesity? And I think Hema said that would be funded from the public health budget where there were some costs. If nobody puts their hands up, I'll assume that we're content with that recommendation. Agreed. The next recommendation was expanding the stop smoking service to try and double the numbers. I assume that everybody's content with that. Unless I hear otherwise, yes. The next one was about extending the stop smoking service to support users of other tobacco use to quit. So that's the use of vapes and oral tobacco use. And the final one was to participate in the text messaging pilot for the increase in the stop smoking service. So unless anybody disagrees with any of those recommendations, we'll minute that we support all of those. And Hema and Tavi, could I just ask that when we have our next report coming, I don't know when it is there, maybe we could have a bit of a summary about the metrics that we are trying to improve and how we're doing against them, and for the team to think about. I always think that ambitions is a better word than targets, but if we could perhaps set some ambitions of where we want to see improvement at a high level, that would be really helpful.
That's fine, yeah.
Thank you very much. I think we're moving next on to an item about vaping and the Tobacco Alliance. Again, it's an update from Hema or one of her team. Is Hema still around?
Yeah, I've joined back.
Okay.
So Louis Duffy, who is our tobacco control lead, will be presenting what has been happening, both with the work they're doing with vaping in young people, as well as the wider. And she'll also present she's got some data for smoking cessation services as well. Thank you, Louise.
Thanks, Hema. Thanks, Nicola.
Welcome.
Thanks to the Health and Wellbeing Board for the time to talk about vaping, youth vaping today. As Hema said, the work we're doing around youth vaping forms part of sort of wider tobacco control work that we're carrying out locally in Bracknell Forest. And so today this is a spotlight on the work we've been doing with youth vaping as we're sort of halfway through this piece of work. So we thought it'd be useful to update. So we've already carried out a lot of work around youth vaping, actually mostly professional and parent-facing work. So we've developed regional and local policy guidance for schools. We've created information for parents and carers that have been distributed to schools about the risks of using vapes and how to handle use if a child is using a vape. We've signposted to resources for schools, and we work very closely with our trading standards team to look at the retail side of accessing vapes. We've already done some professional consultation as well with our designated safeguarding leads, school nurses, our young health champions and some council members. But we thought it was actually useful to hear from young people themselves, really to sort of get under the skin really of the issue around vaping, why vaping is so appealing, and what we can do really to tackle vaping locally in the absence of any kind of national direction. So hopefully you've seen all the slides. I wanted to sort of share some of the points really from that work which we carried out late last year. So we wanted to carry out some insight work with young people, and we also included parents as part of our sample. So we worked with a local organisation called Healthy Dialogues, and they carried out some interviews, focus groups and online groups with young people across Bracknell Forest, and also parents as well, online focus groups with parents. There was a mix of young people who had said they had used vapes and those who had never tried vaping. And parents also, again, a mix, those who have children who've never vaped before to their knowledge, and also who know that their child that has used or regularly uses vapes. And the purpose of the work, as I say, was to get under the skin of the issue, but also really to help us move the work on strategically. I think we really wanted to build our knowledge and really understand what the issues are around vaping, how we can take the findings from that work and move that work forward with local partners. So I won't go into sort of lots of detail of the findings, but I've reported the highlights, but there is a detailed report that sits behind this presentation. But what it's enabled us to do is really think sort of carefully about three sort of different elements and three age stages. So we're looking at the findings according to the COM-B model that we often use in looking at behaviour change, which is the capability, opportunity and motivation. So looking at kind of what young people think, how they behave around vaping, and also kind of what opportunities, how they access vapes, and what's their motivation around using vapes or not using vapes, and trying to sort of understand that and piece that together. So we've kind of analysed the findings, and I've presented them in this presentation, hopefully, which you've managed to had an opportunity to digest according to that COM-B approach. And what we wanted to do is, as I say, sort of move that work on and use these insights as a way of kind of being able to kind of stimulate discussion with our partners. So you'll see in the presentation that we took the findings and we carried out a multidisciplinary workshop with our key partners, so teachers, professionals who work with young people. We had young people in the workshop, parents, anyone who would sort of have a stake really, an interest. We had trading standards involved as well, and we came up with some pen portraits that reflect those three stages. And the three stages are young people who have never tried vaping at all, so they tend to be pre-secondary, and so we need to think about the sort of prevention messages. And then young people who may be slightly older that may have tried vaping once or twice, and we look at that from a peer-to-peer transmission point of view. And then perhaps tend to be more older young people or students who may regularly use vapes or thinking about using vapes. And so we kind of looked at what the findings are in relation to those three groups, as well as parents and retailers, and also teachers and professionals who work with young people. So we considered those audiences, and within those audiences we looked at the findings, and we created sort of pen portraits to help the participants in the workshop to really sort of think about or visualize that individual, that group of individuals. And based on that work, we came up with a range of recommendations, ideas, plans and things that we or interventions, education messages that we'd quite like to use to engage those groups. We thought about things like, what outcome do we want for that person? How do we help them to achieve that? What messages do we need to give that individual or group of individuals, and the tone, format, the style of those messages as well. So what we're planning to do now, this is the sort of next step, this is where we're at now, is to, we've created a sort of small working group to look at those audiences in more detail. We're developing a youth co-produced messages and campaign for young people, which we're doing in partnership with our young health champions. And we're also looking at to look at that kind of prevention side, the transition period from year 6 to year 7. So from primary to secondary, we're going to be working with primary and secondary schools at that time. And we've already been in touch with a head teacher who's expressed an interest in this work, to look at how we can kind of engage both parents and young people of that age to help kind of instill those prevention messages around vaping. So that's the sort of the work we're doing around youth vaping. We're really hoping to kind of, do it. There's no sort of single approach. It has to be that sort of multi-pronged approach. And as I said before, alongside this sits the trading standards work. They have generated lots of ideas in that workshop, and they're going to be taking those ideas and transforming those into interventions such as education, information, training for retailers. And they're already doing a lot of test purchase operations in Bracknell Forest, so continuing the work they're doing already, but also trying to sort of increase the education awareness around vapes. Hopefully this will come and sit alongside also some of the legislation that will be coming in soon around the banning the use of and sale of disposable vapes, and the appealing colours and flavours that young people have told us that they actually really like. So that's the work around vaping. And then we've got, as Hema mentioned before, using the funding from the DHSC, we're going to be looking at how we can support those young people who tend to be sort of older, to support them with quit vaping. So using our Stop Smoking service to look at how they can support young people, and that will also sit alongside some other intervention work in schools. And also looking at our target groups as well. So we in Bracknell Forest, and this reflects nationally as well, there are certain groups of our population where vaping and smoking as well, going on to smoking now, is more prevalent, particularly those in routine and manual occupations. So we're looking at how we can really target those groups and really target those population groups and those who are in routine manual occupations to bring the smoking prevalence down. So again, that will be kind of additional capacity within our Stop Smoking service, but also, more targeted work that we can link in with our tobacco control work, such as the smoke-free places, smoke-free workplaces, smoke-free parks, lots of trying to sort of really get that smoke-free environment agenda sitting alongside the stop smoking capacity. I think that's everything for now, but please do ask questions if there's anything else.
So Louise, thank you so much. This is a subject that I know people feel very passionately about, and how great that we've got our young health champions and head teachers who are willing to work with us on this. So just opening it up to the meeting, are there any questions or reflections that anybody has on anything Louise has raised? Megan.
Hi, thanks. I just wanted an update with has the bill gone through Parliament, and is that going to make a difference? Because was that going to stop single-use disposable vapes? Yes, it is.
Sorry.
Louise, do you want to answer?
I don't think it's gone through yet, and the idea is that it stops single use, but we're unsure how it's going to sort of land. There is concern, would it drive young people to buy, access illegal vapes, or the refillable vapes, because they will still be accessible. So it goes some way to reduce the availability, particularly of these disposable vapes that have, as I said, the different colours and flavours and the things that are appealing to the young people about the vapes. And we're hoping as well, obviously, that will then reduce, because the other thing I haven't talked about today, but I'm really keen to sort of consider, and we have been talking to environmental services about this, is the environmental impact of disposable vapes as well, and also the not only the risk of the fires happening. I know that this we've heard there have been a number of occasions where that's happened, but also the landfill as well. So yeah, so it's not gone through. We've got obviously high hopes for it, but it's not going to be the sort of silver bullet. We need to kind of bring in all those other interventions as well to solve this.
And just a follow-up question, I'm quite surprised at how low the statistics are for children. I mean, I was out with my friend in Kenya, but she's British, last night, and she was telling me that she went to give her son a kiss goodnight, and he's 13, and he'd fallen asleep holding a vape in his hand, and she'd caught him vape. So it's almost like kids are realising they can vape at home, and she's caught him in the bathroom, about to get in the shower, holding a vape. So it's almost like he's become addicted at such a young age. So I was quite surprised at how low. Were you surprised at the low numbers, or were they? When I was looking at the statistics, it's only, I mean, I say it's only, but it was something like 9%. Sorry, let me get it back up. But it wasn't as high as I thought it would be in the younger age groups.
Yeah,
maybe
in the younger age groups, or I think it's. I mean, it's the point to note is that it's increasing, so it's on an upward trend,
exactly.
and that's the worry. So not one single young person should be vaping. No one under the age of 18 should be using a vape. Vapes are sort of, as we know, only designed to support those who are smoking to quit to quit smoking, and using it as a sort of stop smoking tool. So I think the thing we need to, as I say, it might feel low, but it kind of is, it's rising. The other thing we have to consider is that it may be a gateway to other substance use as well. Particularly sort of nicotine, with a nicotine element in the vape. So yeah, it is just so alarming how not just even that 13 but younger. So that's why we're trying to sort of think about those age groups in very different ways. So as I said, prevention, peer-to-peer transmission, and cessation. But yeah, I think hopefully that answers your question okay.
And I think just for that account, sorry.
Yeah, I think really helpful clue for us to all look at the trends and realise that the numbers are reported numbers, so they may not be completely accurate. Sorry, Vega, did you want to come in again? No. Okay, so a really comprehensive plan. Can't thank the team enough for all the work that you're doing, and let's hope it does have an impact over time so those numbers do change. Are there any other comments on that part of the agenda before we move on? Okay, and just to keep you on your toes, I missed out an agenda item, so we're going to go back to the Pan Berkshire Suicide Prevention Strategy, and I think that's you again, Hema.
Yeah, okay. So again, I'll go through the highlights, and it's open for discussion. The board may remember that we did bring a Pan Berkshire suicide approach to the board in 2021 to agree whether we take that approach to develop a health Pan Berkshire strategy. The board agreed to that approach, and a Pan Berkshire strategy was developed. Following on from that, there was also a request that there should be an action plan or implementation plan built with the strategy rather than just a strategy. There has been work going on, but due to some restructure and as well as in Pan Berkshire, the DPH left, and there were gaps in the service provision in terms of coordinating a Pan Berkshire strategy group network. There has been a delay, but last year we got a interim DPH in West Berkshire because they lead on the Pan Berkshire group, and they also had an interim person come in to lead on the Pan Berkshire group. So we have really worked to formulate an action plan to implement the strategy. In the meantime, the national strategy also came out, so it was quite important that we review the national strategy and look at actions within that and align our implementation plan to both the Pan-Berkshire strategy as well as the new national strategy. So I can report that, after a little bit of turbulence in the system, we are now well settled for the Pan-Berkshire group. But it is a complex system. It's a complex system because we have Bob, which covers the 3 local authorities, and then we got Frimley, which covers our 3 local authorities, and we've got Thames Valley Spin, which is the Thames Valley Network, Suicide Prevention Network. So there has been quite a lot of work to look at the governance of the Pan-Berkshire, the suicide prevention within our system. And within the paper, you can see that we have worked out what the governance looks like and what the different groups then feed into that governance. The governance lies with the directors of public health. They're accountable, but no single body can actually implement a suicide prevention or support prevention. We've also then agreed that each health and well-being board is where we bring our Pan-Berkshire action plan, but also our local plans, how that maps to our local plan. So you will see within the action plan, I have in highlighted color, I have said where those actions sit within the health and well-being strategy or other strategies within Bracknell Forest. So just mapping where we are already doing work rather than creating another action plan, because I think that we just keep on creating a lot of action plans. So I have tried to map that. So that's within the action plan. Some of the important things I think which are important still in terms of some of the risks that we need to be aware of, that if you look at the actions, both national actions and local actions are support for bereavement, which we have now. I've heard just last week that Bob, which is the lead organization for procurement, has extended the contract with Amparo, which is the bereavement services across Berkshire and Bob. So Frimley, in terms of Frimley, is the 3 local authorities within Frimley, but we know that Surrey and Hampshire have their own bereavement services. So that contract has been extended. So that's good news. And they cover both children and young people as well as adults. So any suicide by children and young people or by adults, the families and support, any people who are affected by them are supported. The other risk, which is we have Thames Valley practitioners. So in the Thames Valley Police, we have somebody who is called as a bereavement support and suicide practitioner who looks at all the data and does present that data. And also she is the point of contact to the family to support them with any bereavement and signposting. That was funded for 5 years. The 5 years came to an end. It has been extended for 1 year, but Thames Valley Police have come back saying that it's not robust enough for them to continue unless there is a long-term funding, because they are also stretched, as we know. And the last bit of risk that remains is the real-time surveillance of suicide. Now that is quite important because the data collected, we need to look at analysis of that data, and we need to look at, for example, clusters. We know that there was a cluster recently in one of the areas. Thames Valley was one of the first areas to come up with a real-time surveillance. After that, it has stagnated with the Thames Valley Police in the data.
Make a cup of tea.
Jonathan, I think you might not be on mute. I would also love
Apologies.
it, but I think you may be too far away. Thanks.
So, but because we haven't been funding that, so suicide prevention is underfunded at the moment, and the directors of public health are talking with ICB, which gets the funding, ring-fenced funding from NHS and through DHSC in terms of suicide prevention. So there is some discussions going on in terms of looking at the spending plan. It's only a 1-year funding from DHSC. We don't know what the long-term funding is. So there are some risks in terms of funding and how we do that. But apart from that, what actions we need to take, I think all local areas are now taking them. We have a local action group, we have an East Berkshire action group, and we have a Pan Berkshire action group. So compared to where we were last year, I think we are in a much better position in terms of governance and understanding who's doing what and the roles played. But we have still got a little bit long way to go. So in terms of recommendations, one of the recommendations we have asked is to approve the action plan. The second is also perhaps we need to look at the spending plan from the suicide funding to make sure that it is aligned to the Pan-Berkshire strategy. I'll stop there and take any questions.
Again, before we go on to the questions, the recommendations, has anybody got any questions or reflections about Hima's presentation? It does feel a very complex landscape, which is always a little concerning when you're trying to manage something that's as important as suicide prevention. So glad you're managing to navigate your way through it, Hima. Megan.
Sorry, I keep hogging the questions. I've just got a couple. One of the highlighted areas of risk was it says transition, and initially I thought that meant children looked after, transitioning to adult, out of care, and I just wondered if they were a risk group, and if they should be identified as a special risk. And then the other, actually, I've got three questions, sorry. And then the second question was, there's no real mention of domestic violence, and yet domestic violence, people who experience domestic violence are about 3 times more likely to attempt suicide than a normal person. So I just wondered if that should be included in the strategy at all. And then finally, the Better Care Fund helps families who've been bereaved by suicide as part of the suicide prevention. But I was just wondering if there was anything else they could do potentially. So
Great.
yeah, so they are 3 questions. Sorry.
Should we take them one at a time, Hima? So the first one is about children in transition.
So the children and young people are a priority. So when we talk about young people in public health, we go up to 25. So that would cover the transition period, Megan, because yes,
and on that, Hima, within that, do we have a focus on those? Because transitioning from children to adult services is a risk area. Is that within that?
It is within that, because the other bit which is important is also the mental health. We know the transition in mental health. So that's part of the services which CAMS and others are looking at, is 0 to 25 now rather than 19. So yes, that's part of that.
And then so reassurance, I think, Councillor, right, that is part of the plan. And then the second one, Hima, was the links between suicide prevention, domestic violence. How do we make, is that part of the strategy? Do we need to state it more explicitly?
And I've seen Sophie has put her hand up. Sophie, was your hand in relation to that? Then we can discuss that.
It was. Thank you, Hima. Thank you. Do you want me to answer that?
Yes, please, Sophie.
Yeah, so I've been sitting on the Berkshire Suicide Prevention Group for quite a long time because of that exact, position. So I know when this strategy was being written, I was kind of trying to push to make sure that domestic abuse at least was kind of referenced in there. Hima mentioned about the real-time surveillance data as well. And even within that data, when I first joined, it was fairly, non-existent in terms of identifying the domestic abuse kind of suicide cases. Now we have got some kind of finer details in there so we can kind of highlight it. And I know it's kind of not, I think kind of obviously the strategy is what it is kind of now, but I think if we can build in more in terms of the action planning around domestic abuse, we're also just about to rewrite our domestic abuse strategy. So we want to make sure that those kind of links, and I think the more we kind of talk about it, the more those links with suicide are made. And of course, we are just, I'll mention it later, but we are just completing a domestic suicide review for Bracknell. So, there is stuff that will come out of that, I think, that that we need to look at from a DA linked with suicide.
Thank you so much, Sophie, really helpful. And at the end, we might add again another recommendation about making those links into the action plan where we can. And then the third thing was a question about funding, Hima, I think, and bereavement. And are we doing enough? Is there any more opportunities through the BCF fund or elsewhere? I think that was the question.
So the funding, the funding at the moment comes from, not from BCF, it comes from the ring-fenced suicide prevention funding that comes. And Amparo are doing quite a good job. In fact, they presented at the Thames Valley about, we now have access to data. So they're collecting more data in terms of how they're supporting. What can we do more? We are perhaps through not so much through the resident, but through organizations also. We are looking at how we have post-vention plans to support organizations, because we know, for example, that suicide by one of the staff, for example, we know that in the ambulance service has got a high rate as well, and they are putting in services to support bereavement support for the staff, but they're also doing some more work in supporting well-being of the staff. So there is work going on within organizations, each organization, in terms of supporting staff well-being as well as supporting bereavement post-vention. In Bracknell Forest also, we are looking at a plan for our own organization in terms of post-vention. When staff are contacted by a family who has had a suicide by death, how do we manage that in terms of, for example, our car park attendants as well, who may be the first at scene? How do we support them? So there is that post-vention plan also for our staff as well.
Thanks. Megan, did that answer your question about BCF budget and bereavement, or did it not quite hit the mark, that last one?
I think so. I must admit, I took these notes yesterday, and I can't quite.
Okay.
I just remember seeing that it was just that the only thing it mentioned was this helping bereaved families, which obviously is needed.
Yeah.
But I suppose it's kind of understanding the wider support networks that are there through mental health services and stuff.
Okay. So I think Hema covered some of that, and there is more going on than was mentioned. Great, thank you. We can move on to
Susan has
yeah.
Hi, thanks, Nicola, and just thank you to the team for producing this piece of work. Just less a question, more a statement, really, that the council has committed funding going into this coming financial year, capital funding to invest in suicide prevention measures around the town centre. So this strategy is really going to help inform that approach and really help agencies to coalesce around what we can do and the investments that we can make in place to make sure that we're supporting all of the other activities going around that wrap around that sort of suicide prevention work.
Thank you, Susan. That's really helpful to have that insight as well. So just going to the recommendations that are in the paper. So I'm just going to read them out, and I'm going to add one and then check that we're all happy with those. So the first one's to approve the revised action plan, which was all seen. The second one is to suggest that a report comes back in the forward plan in December, so that we get a bit of insight into how the plan's going. The third was to then refresh the action plan in readiness for next year in March 25. The fourth recommendation was to ask for clarity from the ICB about the ring-fence suicide prevention funding and how it's planned to be used. And then I wondered if the board would be happy to add another recommendation about when the action plan does come back in either December or March, building into it something around those links between domestic abuse and suicide prevention. So people happy to support those recommendations? Okay, marvellous. I'm always overwhelmed when you and your team come and present, Hema, with how much is going on. So huge thank you to you and everybody within the team and partners that support the work. That's brilliant. Okay, the next item on the agenda is whether any of the agencies or members of the board have anything in particular they want to update that hasn't been on the agenda. So I'll open that up. Is there any other items that partners want to update on that we haven't covered on the agenda? Nope. Okay, thank you very much. I'm then going to hand over to Lizzie, who's going to help me go through the technicalities of what we do next so that we get it right. So over to you, Lizzie.
So just to explain, the next item is includes a restricted annex, which isn't publicly available. So we just need someone to propose and someone to second the motion as set out in the agenda. Chair, are you happy to propose that?
So I'll propose the motion as set out in the agenda, and Susan has seconded that first. And if we could just check that all our public members have logged off. Alan, that's you. If you're still with us, I'm afraid we have to say goodbye. and that there's nobody else on the call that shouldn't be. Lizzie, I'll rely on you to tell me when we can progress.
Yep, I'll just remove Mr. Thompson. Thank you for joining us.
Thanks very much.